down of budget for 2025 per program. Yun lang po, Mr. Chair.
Mr. Chair, just to
Yes.
clarify, Mr. Chair, can I? Just
Yes,
to
please
clarify.
take note of the manifestation of Congressman Wilbert
Yes,
Lee.
we will comply. Just to clarify, Kong Wilbert, when you say per program, so
Yes.
so can
Estimated budget, like how much is allocated for hemodialysis, for maternal care, for
Understood.
yung ganong
duly noted, Mr.
per
Chair.
program.
We will comply.
Yes.
Thank you.
Thank you, Mr. Chair.
Congressman Ramon Gutierrez, you are recognized.
Thank you, Mr. Chair. Mr. Chair, we've had a long hearing na po, no? And most of the questions have been answered. And I think at least the most important one was answered, the question of whether or not PhilHealth can function without the subsidy. And that was the primary purpose of this briefing. And of course, before anything, we'd like to thank the PhilHealth for taking the time to have this briefing today. I understand this is not our regular hearing. And despite the rules, they were able to come here and address that issue. So primarily, we can get that off the table. Most importantly, PhilHealth will function even without the subsidy. Because there's a lot of, as Kong Jude said, a lot of misinformation going around. Now, without the subsidy, PhilHealth will fail to function or would work at a limited capacity. Very clear na po na hindi po yun mangyayari. However, unfortunately, we've uncovered other issues, and these issues are not new. And of course, we understand it's shared frustration, sabi nga po. But if someone such as Congresswoman Kimbo, who has really devoted a lot of time and expertise into this field, is confused, how much pa po kaya kaming other members dito? So I hope the PhilHealth would continue to work with us. I know this will not be this may be the first briefing on this matter, but I hope it will not be the last. I hope if the committee should decide that this would come under jurisdiction to discussing excess funds po, no? Then I, for one, would be in support of that. Kasi nga po, ang nakikita po natin, I wouldn't agree with calling it defunding nga po eh. I'm sorry, but the way we see it is that yung confusion na lang po that Congresswoman Kimbo was driving at a while ago is just the amount. But very clear, there's a resounding answer that yes, flush with cash pa po yung PhilHealth. So I think that's something that we have to discuss because we really have to focus on the issue of this being social insurance po, no, rather than for profit. But with that said, there's just one question lang po that was left unanswered in my opinion. And I believe perhaps, I'm not sure which official of the PhilHealth would be able to answer, Mr. Chair, but I was surprised to find out, I was just basing on the National Healthcare Act, that very clear, this was also repeated by Chairman Joel, na in the case of excess funds po, no, excess of the reserve, there were two options. It's either to expand the coverage or to reduce the contributions. And the general understanding for most members here would be when you reduce the contributions, we're talking about the rates, the rates that we contribute as premium. But it was mentioned by Dr. Domingo earlier po, no, that he takes the stand of the management in which Section 11 does not call for reduction of rates, but just talks about reduction of contributions. As compared to Section 10, his basis was Section 10 had very specific rates in a 5-year time span, no? 5 or 6 years. Could the PhilHealth please clarify? Because he also mentioned that as a policy consideration, they are waiting on your proposal. So what do you mean now under Section 11 when you're talking about reduction of contributions? Kasi sa amin po, ang naintindihan po namin, it's plain and simple. If you take the word as it is, it's just the reduction of the rates in which we are contributing. But if the opinion of the PhilHealth is not a reduction of rate, what then are we reducing kaya po? How does this redound to benefit our member contributors?
Mr. Chair.
Yes, please, Mr. Ledesma.
Thank you for the question. If I can allow CEO Eli to address the question. Thank you.
Attorney Santos, you're recognized.
Mr. Chairperson, Honorable Representative Gutierrez, our interpretation is that the members' contributions refer to the rates as enumerated in the schedule under Section 10 of the Universal Healthcare Act. We respect the opinion of ASEC Dr. Albert Domingo. However, that remains, but we are open, Mr. Chairperson, Honorable Representative Gutierrez, to study on how we can reduce the contribution of the members without touching on the premium rates. Mr. Chairperson, Honorable Representative
Mr. Chair,
Gutierrez.
most respectfully, so what does that mean po kaya for us? I mean, without reducing the rates, what does Section 11 mean then? In layman's terms po siguro para maintindihan po namin. How exactly would it look like? If you're not reducing the contributions of members based on the rate, how do you see an application of the second part of Section 11?
Mr. Chairperson, Honorable Representative Gutierrez, right now, I do not see how we can implement decrease in the amount of members' contribution without going to the rates. However, again, we are open, Mr. Chairperson, Honorable Representative Gutierrez, to study the view of ASEC, Dr. Albert Domingo. Mr. Chairperson, Honorable Representative Gutierrez.
Mr. Chair.
Dr. Domingo, you're recognized.
Thank you. Just a quick interjection. So nakita po natin no, na dito pa lang sa kwartong ito, maaari mag-disagree yung management sa kagustuhan ng board. So sinasabi po ni Honorable Acop, yan po yung sinasabi namin na not everything is the board or the benefits committee, the BENCOM. It really has to emanate from management. Kasi kung sila mismo may ibang pananaw, nagsalita na po yung supervising agency na may pananaw kami, diyan po nangyayari. Thank you, Mr. Chair.
Thank you, Mr. Chair. So I see now the conflict of opinions. But can we agree on one thing, though? Without touching then the rates, could Section 11 be referring to suspensions or moratorium as a possibility of implementing the intent of Section 11?
Yes, Mr.
Yes,
Chairperson.
before you respond, the chair would like to recognize the Honorable Micaela Angela Swansing. Yes, please continue, Attorney Santos.
Yes, Mr. Chairperson, our answer is yes.
So at the very least po, no, we can talk about suspensions and moratoriums of payment, and this does not require any other further legislation. This will come from you, management of PhilHealth, in applying Section 11. Would that be a fair statement?
Mr. Chairperson, based on history, in 2021, we suspended the increase in the premium rate. Instead of 3.5% for the year 2021, we maintained the rate at 3%. We repeated the same in 2023. Instead of implementing the increase to 4.5%, we maintained the 4%. So yes, we can recommend that to the Office of the President, because the decision during this time was made by the Office of the President. Mr. Chairperson, Honorable Representative Gutierrez.
Thank you very much, Mr. Chairman. Then I hope that you could consider the pleas of most of our members here, because while we have been talking about, and we applaud the efforts po, no, we understand the difficulty in trying to increase the benefit packages, pero quite simply po, hindi po nararamdaman ng tao eh. Because although we might on paper be saying na increase po yung packages up to 50%, in some cases 100% increase ng coverage, pero for as long as the inefficiencies are not addressed, for as long as the district hospitals are not paid, for as long as doctors refuse to accept PhilHealth patients, hindi po mararamdaman ng tao yung benefit packages. Anong mas mararamdaman po nila? Moratorium, suspension. Because this is universal. This is not only those who would stand to benefit from the packages, but from every direct contributing member. So I hope you understand where we're coming from po. And a favorite phrase of President Ledesma, we hear you loud and clear po, no? And I hope you do hear us. Kasi po, I think that's one thing that we're going to drive at. Because for as long as I mentioned, sorry to repeat it, for as long as inefficient pa po yung service delivery ng PhilHealth, I don't think mararamdaman po talaga ng tao yung expansion of coverages or benefit packages that we're talking about. I'm sorry, the video presented earlier, it's all well and good, it's welcome news. But for as long as hindi po nararamdaman ng constituents po namin, actually kami po, for example, sa mga riders, pag lumalapit sa amin, we try to bridge the gap between PhilHealth, yung public and private health structure that we have. But at the end of the day, ang mas gusto nila, maip pa rin po eh. Plain and simple, they'd rather just have us be a bridge towards the DOH, because the PhilHealth, for as long as they could see, is inefficient. It can't be counted on. And these are already contributing members po. These aren't even your indirect contributors. These are people with means. So, yun lang po. I just wanted to repeat that, yes, okay, at least we've settled the matter of the subsidy issue. the PhilHealth has cash, they can continue to operate. But now we're talking about the efficiency of the operation. We're talking about the excess funds. So, yun, I join, if ever this hearing, this committee would take cognizance of this jurisdiction to further hear this out po, no? If this becomes further an inquiry na into the excess funds, I would very much support that. And with that, Mr. Chair, I'd include my interpellation. Thank you very much.